Hello, everyone. Good morning, good afternoon, good evening, depending on where in the world you are joining us from. Welcome to today's webinar, Publish with Wiley, Scientific Writing Tips for Non-Native English Speakers. Thank you for spending some of your valuable time with us today. My name is Amy, and I'm a member of the training team. I have a few housekeeping items to go over before we get started. This webinar is being recorded. You will receive an email with a link to the recording in 24 hours, along with a certificate of your participation. So look out for that email after about 24 hours. Also, the presentation that's being used today is linked in the handouts section of your GoToWebinar panel. So if you click on the handouts section, you'll be able to download this and keep it as a reference. Additionally, please note the questions section in the GoToWebinar panel. We encourage you to ask questions, and they will be monitored and addressed at the end of the session. Now I'm happy to introduce today's speaker. Dr. Radhika Shridharan is the Deputy Editor of Cancer Medicine. Radhika has a significant experience spanning 2 decades in biological sciences research and publication industry. She handles end-to-end article publication cycle that includes, but not limited to, evaluation of scientific, ethical, and technical aspects of manuscripts, managing peer review process, driving editorial decisions, author and external editor engagement, process optimization, handling research integrity best practices, thereby helping to publish coherent and scientifically sound content. I know we're really excited to learn from our speaker today, so with that, I'm going to hand it over to Radhika.
Thank you, Amy. Hello, everyone. I'm very happy to be here to speaking to all of you about some scientific writing tips. And many of you might be in the midst of writing your research manuscripts now. And as you do that, you may have many questions, such as, does my sentence read well? Is my writing grammatically correct? Are my sentences wordy? Or does my writing convey the exact meaning that I want to tell the readers? And so on and so forth. So through this webinar, I hope to answer some of such questions. And my aim is to help you identify and correct the mistakes as you communicate your science and findings to the larger scientific community. So through this webinar, I'll try to introduce you to the concepts of sentence construction and word choice. And these concepts, to a large extent, are what will determine your overall manuscript quality, how it will read, and if you're able to communicate what you really want to say. I'll just turn off my camera for so that there is no distraction. All right. Before we begin, I'd like to let you all know that excellent writing can never mask poorly conducted research, but an excellent research piece might not get the recognition it deserves if it is poorly presented. So it's always good that you have a strong story to say, and your story needs to be your guide. So without the support of a core story, usually all the paragraphs that the author writes will look like a pile of random study findings, which have been conducted by other researchers and which have been reported in other articles. So if there is a lack of author's own narrative, author's own perspective and understanding of the topic behind the words that they are writing, that is what leads to poor presentation skills. While it is challenging to go through the entire gamut of English grammar in this 1-hour session, I have tried to put together a few errors that I come across routinely when I review the manuscripts. So generally, these are the 4 aspects that any journal editor will look for when they review a manuscript for the first time. So grammar, readability, style, and vocabulary. So before we start discussing the topic of today's seminar, I'd like you all to take a poll today. The first one, which is why we conclude that the EV fingerprint test reduced unnecessary prostate biopsies. So I just want you to go through this sentence and let me know if the sentence reads okay or not.
Okay, I'm going to open the poll for everyone, and you'll see the question. And you may answer, yes, it looks fine to me, or no, it doesn't make sense. And I'm going to give everyone a few moments to reply to the poll. It is anonymous, so you don't need to worry about any of your answers being recorded. Okay, we've got about 30% of people have voted. Going to leave it a few more moments. Okay. And thank you for your participation in the poll. Okay, we have a very good response. There's a couple more coming in. In a moment, I will share the results and everyone will be able to see how you have responded. Okay, I'm going to close the poll. Thank you. And I'm going to share the results. Okay, Radhika, can you see them?
I cannot see it.
Okay. Okay. Well, I will tell you that 37% said yes, it looks fine to me, and 63% said no, it doesn't make sense.
Okay, that's very good because the 63% is the correct answer. So basically, a sentence is considered complete only when it can stand on its own and make complete sense. So this sentence is incomplete because it doesn't make sense by itself. So that comes we come to the first type of error called as the sentence fragment. So
Radhika,
hello?
Radhika, I'm sorry to interrupt you. I'm not seeing your screen, so maybe it got accidentally stopped sharing. Are you able to show your screen? Maybe that's why the poll didn't show for you. Okay, now I'm seeing the slide that says sentence fragments. That's perfect.
Yes, all right, yeah. Sorry, webinar is incomplete without technical glitches. So I'm glad that we are past that now.
This is true, thank you.
All right, so the first type of error that we usually come across is called as a sentence fragment, which occurs if incomplete sentence is punctuated like a complete sentence. So sentence fragments cannot stand on their own, and it can occur because of a variety of factors such as missing subjects, missing verbs, afterthoughts, abandoned clause, words meant only to support or describe another idea. And most often than not, it also occurs because of typographical errors or omission of words. So how do you correct for sentence fragments? So you check that your sentence is complete and makes sense on its own. Let's see examples for each of the category that I mentioned previously. The first type of sentence, one of the sentence fragments, the error that can happen is because of a missing subject. If you see in this sentence, use 10% lignocaine spray via oral cavity. The question that follows is who used it, right? Because this is an incomplete sentence and the reader does not get a full idea of what the writer is wanting to say. So you add the missing subject. You can say the anesthetist or the doctor, the physician. So the anesthetist used 10% lignocaine spray via the oral cavity. Now this makes a complete sentence. The next type of sentence fragment can occur because of a missing verb. If the fragment does not have a verb, the patient suffering from weakness and shortness of breath, right? So again, the reader is left with the question, okay, what happened to the patient? There is something that is missing in here. So you add the missing verb. So you say the patient is or was suffering from weakness, Or you tell the reader what happened to the patient. The patient suffering from weakness and shortness of breath was admitted to the hospital or was taken to the emergency, so on and so forth. The third type is the afterthought. Fragment was added as an afterthought. What is an afterthought? The writer would have written, the author would have written a sentence and would have placed the period, would have ended the sentence, and there is something, some idea which comes again, and then that is written after the sentence has been completed. So in this example, there are several risks for diabetes. There's a period after that. For example, family history, ethnicity, blah, blah. So the second part of the sentence leaves the reader wondering, okay, what is this an example for? Okay, is the example doing anything? Is this an example for the previous sentence? Is it an example for this for some thought that has been presented in the previous paragraph? So how do you correct for this? You correct using a comma to complete the sentence. There are several risk factors for diabetes. You put a comma there. For example, family history, ethnicity, etc. The third type is, so the next type is the abandoned clause. So if you look at this sentence, when we discontinued alprazolam, so what happened to the treatment? What happened when the treatment was discontinued? What happened to the patient, right? So you complete the sentence using a comma. You see, when we discontinued alprazolam, the patient stopped experiencing the side effects. Or you tell the reader what happened to the patient or what happened subsequently. Then in the next example, if you see, the medication was stopped, and that is a sentence. If the symptoms had subsided, that is another sentence. So words meant to support or describe another sentence is written as a separate phrase or as a separate sentence. So in this example, if the symptoms had subsided, so what happened if the symptoms had subsided, right? The reader will not know. So how do you correct for this kind of an error? So you connect the two sentences with a comma, or you can add the fragment, the fragment that is just hanging in there as an introductory part to the previous sentence. So you can say, if the symptoms had subsided, the medication was stopped. Let us come to another poll now before we move on to the next type of error. Please see this sentence. The patient fell on the street. He had a medical history of hematoma and vascular dementia. So I want you to tell me if this sentence reads fine.
Okay, the poll is open. Please answer if it looks fine or something is amiss. Give you a few moments for everyone to vote. And then we will share the results as last time. Okay, lots of answers coming in. I appreciate that. Give it just a few moments for everyone who wants to place their vote in the poll. Okay, going to close it in a moment. Okay, closing the poll and sharing the results. Radhika, can you see them this time?
No, I think you can just call out the results every time, Amy. That would probably be easier.
Okay, I'm not sure why they're not showing up, but the answers that we were given were 34%, yes, it looks fine to me, and the larger percent, 66%, no, something is amiss.
Okay, that's very nice. Because if you see in this sentence, the first part of the sentence and the second part of the sentence are standalone sentences, but they have been joined by a comma. So that brings us to the next type of error, which is punctuation, and that is called as the comma splice. So comma saves lives, because if you say let's eat kids without a comma, you're actually eating the kids. Whereas if you say let's eat comma kids, then you're calling the kids to eat. So it does save all the lives. and also many embarrassing moments. So the comma splice occurs when two complete sentences or independent clauses are joined with a comma. So how do you, how do you rectify such sentences? Don't join two complete sentences using a comma, as easy as that. So you can look for comma splices by examining the comma in a sentence. You can see, compare the two parts it separates. For example, here, we recruited 500 patients and conducted the blood test. There's a comma here. The results were still unreliable, right? So if you compare the two parts it separates, if these parts can serve as complete sentences, then the sentence has a comma splice. So how do you correct for the comma splice? You can either use a period, you can use a semicolon, or you can use a comma and one of the fanboys, that is the conjunctions for and nor, but, or, yet, and so. One thing that we need to keep in mind is that you should never try to join two sentences with a comma followed by a conjunctive adverb. Now, what's a conjunctive adverb? It's an adverb that joins two sentences which have two separate ideas. So using a semicolon or a period in front of the second independent clause, as in here, you can correct for the comma splice. So however, moreover, alternatively, thus, all these are conjunctive adverbs. So when there are two sentences which are separated by a conjunctive adverb, you must never use a comma. You can either use a semicolon or you can use a period. All right, let's come to the next poll now. If you can read the sentence here, about 85% of lung cancers are NSCLC. One of the subtypes is adenocarcinoma.
Okay, here's your poll. Okay, we have voters voting. Thank you. I'll give that a couple of moments. Okay, thank you for your participation in the poll. I'm going to close it and share the results. So for this one, the results are that 9% said yes, it looks fine, and the larger percent, 91, says no, something is amiss.
Very good. Because if you look at this sentence, it looks as a fused sentence or a run-on sentence, which occurs when two complete sentences or independent clauses are joined together with no connecting word or punctuation. So how do you correct for fused sentences? This can fused sentences can occur because of typographical errors as well, or it can occur because of genuine mistake if the author doesn't know that it's a fused sentence or a run-on sentence. So run-on sentences can often be very difficult to read and comprehend for the reader. So you can correct the fused sentences or run-on sentences as you would correct the comma splice. So as in this case, you can use a period, you can use a semicolon, or you can use comma and one of the fanboys. So you separate the two sentences so that it makes sense. So always check that your sentence is complete and it makes sense on its own. Right. With that, let's go to the next poll. If you can read the sentence, the patient was referred to a specialist with stomach pain. How does this sentence read?
Poll is open for voting of yes, it looks fine, or no, it doesn't make sense. Okay, we're getting really great participation. Thank you for voting in our polls. Give you just another moment. While you're voting, I'll just remind you to download the handouts. This way you won't have to worry about taking notes on all this excellent information that's being provided. So do download the slides in the handouts section. Okay, we have a great result here. Just a moment. So for this one, the answers are that 44% said yes, it looks fine, and the larger percent, 56%, said no, it does not make sense.
Right. So this is an incorrect sentence. So it has an error called as the modifier error, misplaced modifier error. So sometimes writers use modifiers incorrectly, leading to strange and unintentionally humorous sentences. So what is a modifier? A modifier is a word or a phrase that adds meaning or describes or clarifies another word or phrase or clause. A misplaced modifier. So there are two types. One is a misplaced modifier and the other one is a dangling modifier. So a misplaced modifier is one that is placed very far away from the word that it actually modifies, that it actually describes. As the name says, it is misplaced. It is not placed in the correct position. Whereas in the dangling modifier, when there is nothing that the word or the phrase or the clause can modify, the modifier is said to dangle. So in this particular example, if you see, the patient was referred to the physician with stomach pain. So did the physician have the ailment? It means that physician with stomach pain. It means that the physician actually had the stomach pain. So this modifying word, phrase is not in the correct position. So you say the patient with stomach pain was referred to the physician. And in the second example, if you see, that is an example for dangling modifier. Waking up in the hospital, the surroundings look blurry. So who's waking up in the hospital, or what is waking up in the hospital? We don't know that, right? It looks incomplete. So you add the subject. So you say the patient was waking up in the hospital. As the patient was waking up in the hospital, the surroundings look blurry, or the surroundings look blurry as the patient was waking up in the hospital. So moving on to the next poll. I think this the poll, the sentence in here might not be visible on your poll. So I just want you to read the sentence and kind of memorize it or keep it in mind. So there's a notice in the park which says no loitering, don't smoke, jumping not allowed on the benches, and parking is not permitted. So does this notice in the park read correctly? Does it read well?
Okay, so keeping in mind that notice, does it read well? Yes, it looks fine, or no, it doesn't make sense. So please go ahead now and vote in the poll, thinking of that sign. Giving you a few more moments. Okay, once again, appreciating your participation. Let me share the results. So for this one, we have that 30% said yes, it looks fine. And the larger percent, 70%, said no, it does not make sense.
Right. This is a type of error called as the faulty parallelism. So faulty parallelism occurs when a list or sentence does not use the same type of words to describe similar ideas. For example, in this particular notice in the park, it says no loitering and don't smoke. So how do you correct for this? You should ensure that in the lists or sentences, you use the same type of words to describe similar ideas. That is, match the nouns with the nouns, verbs with the verbs, adjectives with the adjectives, etc. So in here, it would have been best if they had put up something like no loitering, no smoking, no jumping on the benches, or no parking, or it says, or something like don't loiter, don't smoke, don't jump, and don't park. So you make sure that the list of words that you're using match with each other, or the conjunctions that you're using correlate with each other, and or they are coordinated with each other. All right. So moving on to the next poll. First, we search PubMed database, then one author selects the studies for review. So how does this sound?
Okay, here's your poll being opened, and you can respond if it looks fine or no, it does not make sense. And while I'm waiting for that, I just want to also remind you to please place any questions you have in the question pane, and we will monitor them and respond to them at the end of our time. Okay, excellent. Thank you for voting. I'm going to go ahead and share these results. So we have 17% said yes, it looks fine, and the larger percent, 83%, said no, it doesn't make sense.
Right. It doesn't make sense because there is a shift in the sentence. So sentence shifts occurs when there is change in the tense, number, or person. So shifts happen when a sentence begins in one way and ends in another way. So this causes confusion to the reader. So whenever possible, make sure that the sentence begins and ends in the same manner. So if you look at the first example here, there is a shift in the tense. Prior to chemotherapy, the oncologist examined the patient and reviews the treatment history. So the examined and reviews. This is in past tense. Examined is past tense and reviews is present tense. So make sure that both of them are in the same tense. So prior to chemotherapy, the oncologist examined the patient and reviewed the treatment history. In the second example, you can see a shift in number. So there is each participant was asked to submit their psychological evaluation. So there is a shift in number here. So you can revise it to say all participants were asked to submit their psychological evaluation, or each participant was asked to submit his or her psychological evaluation. So make sure that there is no change in the number that you are describing. If it is singular, it has to be singular. If it is plural, it has to be plural, which is what we are which we see in the third example. Before one prescribes the medicine, they should check the pulse. So, which is incorrect. The revised sentence would read, before one prescribes the medicine, one should check the pulse, or before they prescribe the medicine, they should check the pulse. So this is the error in the sentence shifts. So we move on to the next poll. Psycho-oncologists are among the most sought after specializations. So I'd like you to read this and tell me if it is okay or if it is not okay.
Okay, the poll is open. Please vote if it looks fine or it doesn't make sense. Okay, giving everyone a moment to participate if they want to. Okay, we're gonna close the poll, thank you. And here are the results. The 39% is saying yes, it looks fine. And the larger percent, 61%, says no, it doesn't make sense.
Yes, it doesn't make sense because we are comparing two different things. If you see, psycho-oncologists are people. They are a group of doctors, group of people, whereas specializations is an occupation. So you cannot compare group of people with specialization. So this brings us to the next type of error called as faulty comparison. When two things are incorrectly compared, it leads to faulty comparison. So whenever you want to draw a comparison, you must check if the things that you're comparing are of the same type. For example, in here, if you read this incorrect sentence, diagnosis of dementia is easier than schizophrenia. So here we are comparing diagnosis with schizophrenia, right? But you're comparing two incomparable things. So how would you correct for that? Diagnosis of dementia is easier than that of schizophrenia, right? Similarly, diagnosis of viral infection is more difficult. The question that follows is, than what? More difficult than what? So is it more difficult than bacterial infection, or is it more difficult than treating the disease? So you complete the sentence by saying diagnosis of viral infection is more difficult than treating the disease, or than that of bacterial infections. Right. So we've So we've tried to complete many of the errors that occur, such as the sentence fragment, comma, splice, fuse sentence or run-on sentence, faulty modification, faulty parallelism, sentence shifts, faulty comparison, etc. Now we come to the other types of errors. The first one is wordiness. Wordiness is using too many words or unnecessary words that makes it very difficult for a reader to understand. The paragraph gets long and it gets confusing. So, and then wordiness is it happens when you are not replacing the phrase. For example, a number of. This is a 3 words which can be replaced by just one word, such as many. Wordiness comes to the fore when a journal has word count limitations. Now, many of the journals these days are which are open access. They don't have word count limitations, but still, many of the journals do have restricted word counts. So that asks the authors to kind of adhere to around 3,000 words or 4,000 words or something like that. So when you have such restrictions, if the wordiness is something that should be absolutely avoided, because the more number of words that you have, the lesser the chances that you have to actually bring forth the essence of your research. So for example, a majority of can be cut short to most. Are of the same opinion can be cut short to agree. We can use now instead of saying at the present moment. We can say rarely instead of saying occurs less frequently, so on and so forth. The second type is redundancy. Unnecessary repetition of words that convey the same meaning is called as redundancy. For example, if we say the solution is red in color, red is already a color. Why do we need to add that extra 2 words in color? You can just say the solution is red, right? So other examples would be 8 p.m. in the night. PM itself is night, so is evening. So you can just say 8 p.m. and collaborated together, plus in addition, or plan ahead, rectangular in shape, right? Rectangle is already a shape. You don't have to qualify it by saying in shape. Summarize briefly. You can say here we summarize our results, because summarization itself is writing briefly or writing succinctly. And another error would be sentence length. If there are, I have seen manuscripts wherein an author has written one sentence in like 4 or 5 lines. So by the time I come to the 5th line, I would have forgotten what the author has written in the first line. And it's very difficult to kind of correlate huge sentences in which a lot of concepts have been dumped together. So it's sentences should be long enough to be considered as academic, but short enough that the concepts are presented clearly. So make sure that you simplify the sentences and break them into parts wherever it's necessary. Now it is science and it is academic results that one is describing. So yes, there can be compound sentences, but make sure that in the compound sentence you are completing your ideas and you are making your concepts clear to the reader. Language and presentation is one of the first aspects any reviewer or any journal editor would look for, and because that is the one which glares at the face of the editor whenever the editor opens the manuscript. So they are always impressed by a well-presented manuscript. So make sure that the language that you are setting on your word processing software is correct and it is in English. And carry out the spell check. Make sure that you ask a senior colleague to proofread or read your entire manuscript before you submit, or you can also ask anybody who is fluent in English to proofread and make sure that the errors are minimized. And always be consistent with heading and subheading. And be consistent with formatting. Use the style guide as prescribed by the journal to make sure that the journal does not unsubmit the manuscript and ask you to resubmit it. Because the author would have spent a lot of time drafting the manuscript, rewriting the manuscript, making sure that all the paragraphs are aligned and all the sections are correctly described, and making all the figures, all the illustrations as per the journal guidelines. So there's a lot of time that the author spends making sure that the article is submission ready. So in order for all that effort not to go in waste, it's always good to follow the author guidelines as prescribed in the author guidelines of the journal, and be consistent in formatting the figures, and make sure that the abbreviations are defined in the first instance, and these have to be described separately in the abstract and in the main body of the manuscript. Many journals, they allow the authors to have a table of abbreviations listed separately. So make use of that provision. So the ABC of good scientific writing is to be accurate, brief, and to be clear. So avoid vague language and language that cannot be understood. That's the author might understand, but what is the use if the editor and the reviewer and the larger scientific community cannot understand the whatever the author has written? Because the ultimate goal is to showcase the result to the world. So make sure that you are precise and specific, and say exactly what you mean. Overstating and understating should be avoided, because the reviewer and the editor will point it out and then they will ask you to tone down the conclusions. And be brief. Make sure that if all the points that you want to say are described in a succinct manner. Focus on what is important rather than going into unwanted details. And make sure that wordiness and redundancy are avoided. And use simple words, and instead of using use verbs instead of nouns wherever possible, and avoid using excessive passive voice. And be clear in your concepts, and categorize each set of information rather than dumping all the information that you have about the topic as one big lump, because it's very difficult for the reader to discern what the author is saying if all the ideas are just put together as one big lump, either in the discussion or in the introduction sections. So for example, if you're talking about a gene or protein of your interest, so be methodical and systematic in writing. So first you describe the structure or the role of that gene or protein in a particular metabolic pathway. Then you describe how it brings about changes in general at the physiological level. Then you get into the specifics as to how this gene or protein behaves in, say, tumor cells or in a disease condition, and what has been studied about it till date, and then what has not been studied about it till date. So if you write methodically using simple words and in a specific manner, it's easy for the editor to appreciate the significance of your work. So one last point is that practice makes everyone perfect, but I do know that in the masters, in your masters or a PhD scholar is always short on time, because they need to design the experiments, execute the experiment, write manuscripts, and do lab presentations, and go to seminars and webinars and attend conferences. So there's very little time left to actually practice writing. But then you'll be surprised that if you at least set about half an hour or 45 minutes at the end of your very hectic day to keep practice writing of your results or your topic of interest, then you'll be surprised to know that how well you would have graduated from being a novice to to the standard that the journal expects. And it's good to read. It's good to read a lot, not just the scientific literature or journal articles, but also read bestsellers or newspapers, novels, or magazines, or anything that you may find interesting, because that gives you a wide range of vocabulary. It gives you a sense of how the writers present their content in different forms, in different types of presentations, and it tells you about the nuances of the language and how sentence construction is done, etc. So last but not the least, we do have Wiley editing services that the authors can benefit from. There are lots of services which are offered in terms of editing or translation, formatting, and writing services or illustration services, etc. So please make use of it if need be. And I hope all of you have nice year of writing loads of manuscripts and getting a lot of publications. And there's always you'll always with each publication you'll always have something to learn from and to improvise upon. So thank you so much for listening patiently through this presentation. And if you have any questions, please do let me know.
Great, thank you so much. These are excellent tips that you have shared today with everyone. I'm going to give some people a chance to post in the question box if they do have any questions at this time. Give you a few moments for that. I don't see any right now. Do want to remind you that the session has been recorded, and you will receive an email with a link to the recording in about 24 hours, and you will get your certificate of participation at that time. So thank you for joining us today in this excellent webinar. I'm going to give you one more moment. Please do type any question you may have. I know we all learned a lot, so there may not be too many questions at this time. Okay, hold on, we're getting one question now. This person would like to know when to use the semicolon.
When to use a semicolon, as in to correct the kind of sentence errors.
Yes.
So if we have two separate sentences which can stand alone, and at that time we can use a semicolon. Okay, supposing we have two different sentences, but then you don't want to use it as two separate sentences, you can always use a semicolon. But you make sure that each of the phrases make sense on their own.
Okay, so that answers the semicolon question. Would you be able to say how to use the M dash?
The M dash and the N dash and the hyphen, they are little difficult to at some point people always confuse between these three types of things. So when do you use the M dash is when you are writing a sentence, and at the end of it, when you want to describe when you want to describe what the sentence is all about succinctly, that is the time you need to use a M dash. For example, if you're saying for example, okay, there are algorithms or something that exhibit a form of statistical smoothing, and when you go on to describe that algorithm or something like that, and you say what it stands for, and at the end of it you use an M dash, which is a longer one, which is a longer type of a dash, and then you say, okay, all these characters are either the desirable ones, or they are not the desirable characters of whatever you have just described. That is where you use the M dash.
Okay, thank you. The question is, do we use a semicolon when providing a list?
Do we use a semicolon while providing a list? A list of that there is no necessity. It's not necessary that when you're providing, supposing you're providing a list of say inclusion criteria for patient selection. When you're listing it, it's not always necessary to use a semicolon.
Okay.
You can just list one after the other.
Okay. If you want to comment on this, I'm not sure if you feel that this is your area, but do you think that the use of AI is a good source to check if the writing is good?
Okay, this is a question that is always asked, and that's something that has been going on for a long time, since the advent of ChatGPT. So it's as journal editors, we always think that if you put anything in the AI, and if you are going to check for the accuracy or something like that, as an author, it is your final decision to make sure that the content that is coming out of it is accurate and unbiased, and all the everything that has been said is correct and conforms to whatever has been there in the literature. Because AI is definitely, this is not my area of expertise, but there's a lot going on around in the editor community as well as in the journals. But whenever anybody is using AI to either correct grammar or to write a paragraph or something like that, the output that is received should always be accurate, and it needs to the author needs to make sure that whatever is being said is and being submitted to the journal is what they have seen previously, that conforms to whatever has been published previously.
Excellent. Always a popular question these days. So that's about it for today. You will get the recording, and you can download the slides in the handouts section. So thanks for joining us today, and thank you to our speaker for your expertise and your time. And I hope that everyone has a wonderful day or evening, and we'll see you at the next webinar. Thank you so much.
Thank you. Bye-bye.